Welcome to Avel eCare Virtual Health Connections. I'm Jessica Gaikowski. Across the country, rural healthcare is at a critical moment. Communities are facing workforce shortages, hospital closures, and growing challenges in accessing care. At the same time, we're seeing something we haven't seen in decades: significant federal investment aimed not just at stabilizing rural healthcare, but actually transforming how care is delivered. Today, we're talking about what's changing, what funding opportunities exist, and what rural healthcare leaders should be thinking about right now. Joining me today is Mark Johnston, Vice President of Government Affairs at Avel eCare. Mark brings nearly 30 years of public service experience, including military service, leadership in the South Dakota legislature, and senior staff roles in the United States Senate. Today, he works with policymakers and healthcare leaders across the country on some of the biggest challenges facing rural healthcare. Mark, thanks for joining us today.
Jess, what an absolute pleasure to be here. And this is so fun. We're kicking off the first episode.
Yeah, absolutely. Before we really dive in, can you kind of give us a little more about your background and what really led you from working with policymakers and government officials, legislature, and now you're at Avel eCare?
Yeah, it's been great. You know, when you were during your opening, I just had to take a minute to pause, and you know, it's been fun. I mean, you know, from my military background, you know, retiring as a colonel over almost 30 years to, you know, transitioning from a full-time soldier to become a governor's press secretary during the Rounds administration, and then getting elected to the state legislature myself, serving District 12 here in South Dakota. To then becoming a senior staffer for my old boss, our former governor, Mike Rounds, you know, working both here in the state and in D.C. I've been beyond blessed with a whole lot of great opportunities, but as my wife reminds people regularly, I can't keep a job. And so it's been a lot of fun. You know, and then a few years ago, Avel was looking for someone to do government stuff, and I was working in D.C. and you know, just figured it was time to come home. And I've known Avel for years. Actually, their headquarters was in my legislative district, so I would regularly do meetings and briefings and get updates about the company. So it was really comfortable for me to think about coming and joining the organization, and you know, just think it's just been a whirlwind these last 4 years for us as a company. So yeah, it's been great, and just continues to grow and thrive, and really grateful for the opportunity to serve in leadership for the organization, and especially during this time. You know, there's so much going on in the government space, federal, state, local. And you know, considering the high number of communities that we serve with various virtual care solutions, it's great to be at Avel right now.
Yeah, it is. When you kind of hit on this, that there's a lot going on right now, a lot of changes going on, a lot of cool new initiatives going on. When you're, from your perspective, working with policymakers, why does this moment feel a little bit different right now?
Yeah. You know, coming out of COVID, telemedicine was kind of the hot topic. But then even this past week, when I was traveling and maybe explaining more about who Avel is to someone that wasn't necessarily as familiar with the company as others, but it's we've really just kind of exploded after COVID. Yeah. And but we're exploding because we're different.
Absolutely. We
don't do any direct to consumer. Somebody can't just call us up and want to schedule an allergist appointment. We're, you know, with our model being a business to business model, supporting hospitals, health systems, and government directly. We've just really been fortunate to have a real strong growth spurt right now across our service lines.
Yeah, Absolutely. So we've been talking about rural healthcare challenges for a long time. That's basically why Avel was developed in the first place. But many leaders now are saying that the pressure on them feels different, and it feels like it's heightened over the last few years. So from your conversations with hospital leaders, government officials, etc., what are these biggest pressure points that these rural communities are really facing right now?
It's complicated.
Absolutely.
And it depends. Like I talked about earlier, if you've dealt with one state, you've dealt with one state.
Yep.
If you deal with one hospital, we deal with one hospital. But I think there's an underpinning of just some of those core things like financial sustainability is key.
Yep.
And that's why having a virtual partner to help those hospital leaders, do more for their patients through a virtual partnership like ours is really key. Workforce sustainability is huge in almost every part of the country. Especially when you're talking about rural and there's many parts of this country that struggle to recruit, retain, and keep providers to take care of the population. That's where we, being a virtual health system that supports these local healthcare entities or supports a government with one of our out-of-hospital services, that's key. The other real impacting element is our rural communities are aging. And so, you've got a population that is, probably born and raised and lived in these rural communities their whole life. And now as they get older, they require more access to healthcare services. And that's across the continuum of what Avel provides for a lot of these rural communities. That's attractive.
Yeah. Can you go in a little bit more to access, and what does that really mean? I feel like sometimes when people think of access to care, it's like, oh, I just don't have someone in my community, but sometimes it's the distance of that. So can you talk a little bit about what access to care really means?
Yeah, and that's really, if you want to get to the core of what Avel began as, and that was delivering specialty care out into the country that created an environment so citizens didn't have to drive into the metropolitan to get access to a cardiologist or a dermatologist or a rheumatologist, pick an ologist. And that's, all the way dating back to 1993, that's our core. And so, now, more than 3 decades later, it's been even more exacerbated.
Yeah, absolutely.
And I think about, we've got such a strong relationship with the Indian Health Service. Super grateful for the opportunity to support the mission of the IHS in the Upper Plains. And, you want to talk about rural, you want to talk about frontier.
Absolutely.
There's a lot of miles between access points. And so a lot of the tribal communities in the Upper Plains, they don't know a provider, especially in the specialists, other than Avel. We have physicians who have supported those communities for almost 7 or 8 years, bumping up to a decade, where they've had this patient provider relationship. It's all been virtual, but that's all they know.
Exactly.
And it has been absolutely warming to hear some of those testimonials from patients about the value that virtual physician or virtual nurse practitioner has on the life of those folks in rural and frontier parts of the country.
Absolutely. When you've kind of hit on like the different areas, So does rural healthcare, like the premise of this, look different in different regions and states, or is the challenges that we're seeing all the same across, or do they look different based upon their territory and region?
Yeah, it's a great question, and I suppose it boils down to the rurality. I don't even know if that's a word, but how for some people in some parts of the country, Sioux Falls is rural.
Absolutely. Mm-hmm.
And we're 260,000 people in the metro. Yeah. But then, it's different. Mm-hmm. But we're pretty fortunate to live where we live here in the Sioux Empire, but able to radiate those services. Being connected to communities throughout the country. Yeah. With virtual services.
Absolutely. So if we are looking at all these different challenges, I know we started off with looking at the different pressures of them, and they've been increased right now. If we don't do something right now to help alleviate these pressures, what does that look like?
You can't open your news browser on any given day and read stories, especially in the healthcare space, about the economic challenges that rural hospitals and healthcare providers experience on a day-to-day basis. Yeah. And, going forward to continue to grow and provide support to those, a virtual partner has to be part of the equation. And, that's probably why we've experienced so much growth lately, over these last few years is because of that reality that all healthcare is local. It's relational, but having a partner like Avel to provide that greater access to care and provide pretty decent support to those local communities is imperative.
Absolutely. In 2025, we passed this beautiful thing that everyone likes to talk about, the One Big Beautiful Bill. Yeah. So if people aren't paying attention to healthcare policy, they may have heard of it, but they don't really understand it. Yeah. Could you kind of give us a little insight into what that really evolved? Because it's the biggest federal investment that we've had in decades. Yeah. So what does that really look like, or what does that mean right now when they're saying we have this big, beautiful bill? What is that?
And did you know that the One Big Beautiful Bill is a nickname?
I sure did.
You did?
Yes.
So,
but that's how everyone refers to it.
Yeah, and that's the commonly understood name.
Absolutely.
But the actual legislation was the Working Families Tax Cut Act of 2025. Yep. But because it was so large and so encompassing, it earned the moniker of One Big Beautiful Bill, but it's the Working Families Tax Cut Act. Yeah. And because of that, historically, and I'm not going to get into the politics of the whole thing, and because this isn't the time or the place. But the reality is, it's about the strategy around how funding was calculated and budgeted for, especially around Medicaid. And, given the economic dynamics of the country at the time and budgets, historically Congress had funded Medicaid year over year at about a 5% increase. Okay. Well, actuarially and from a policy perspective, Congress made the decision to dial that back to 2.5%. Okay. So naturally, that would mean reduced funding for Medicaid because, in theory, there would be a reduced need for Medicaid in the states. Okay. But that caused a divide. That caused challenges, especially in rural America, that rely on Medicaid funding for sustainability. Hence, a group of folks in Congress got together and came up with this concept to try to offset some of those reductions. Yeah. Hence, we got what we now know as a $50 billion appropriation called the Rural Health Transformation Fund to go directly to the states, 5 years, $10 billion per year, allocated not on a per capita basis, but similar.
Yeah.
But because there are rural states, smaller populations that got as much money as a large state like Texas.
Yeah.
With a large population. So
yeah.
there is a difference on a per capita basis, but that's how it came to be.
So when we're looking at the by state kind of difference of that, how did the states kind of come up with what they're looking for? Like, what did that process and planning look like? Because you can't just get a load of money for nothing. How did they put some initiative or strategy around those?
Yeah, that's been fun. I've had the really, really good fortune of engaging with many states directly, and if you look at Avel as a company, we're based here in the Upper Midwest, but we support hospitals, health systems, governments in 46 states today. From the state of Washington, California, all the way down to Texas, all the way up to New Hampshire, Vermont, and Maine, and all across. So there's really, we've got such a huge footprint. But if you focus on our core, it's that 21, 22 states right down the middle of the country where, historically we have been so strong. And so, in short, to answer your question, it depends. But there have been some states that have taken a centralized look at this, a centralized approach, led by a governor, led by the governor's office, and then deployed it out. Other states, they've taken a more by committee approach, organizing advisory committees of stakeholders in that state to help shape the plan. And so it's just been a wide variety of strategy that the states have gone through. And, some states, really their hospital association or organization of hospitals has had a significant role in building that plan. So it just depends. There's, some states are totally hospital-based. There are some states that are more balanced. There are some states that are more structured, less structured. Again, if we deal with one state, we deal with one state.
Absolutely. So when we're thinking of when they came out with rural health transformation, what was their original goal with that? I know we talked about, it came from the one big beautiful bill, but now what is their true goal? What are they trying to shape here? Well,
and I'm just going to use the vernacular of the day: make America healthy again, and make rural America healthy again. And that's really a lot of the emphasis of improving healthcare outcomes for a part of the country that needed better access to care.
Yeah. And I think it goes into the challenges that we talked about a little bit before: access to care, looking at the workforce shortages and all of those other components as well.
Yeah.
Yeah.
As a company, I think we did like 41 or 42 state, we answered 41 or 42 requests for information.
Yep.
Which is
amazing.
Huge.
Yeah.
It's been a whirlwind. And going back, I should have qualified, this legislation was signed into law in July of last year.
Yeah.
And then a notice, really the notice of funding opportunity came out in September.
Yep.
And states were required to submit their original strategy, their verbiage in November.
Okay.
And it was limited. It can only be so many pages long, so many words. And so, this has just been a sprint over the last number of months to get us to this point where, budgets were finally approved by the Centers for Medicare and Medicaid Services just a few weeks ago. And so it's time to go.
Yeah.
Time to get to work.
So what does that look like now when we're saying it's time to go? The funding has been allocated, but now how do we get started? What are those next steps?
Well, a lot of these strategies are hinged on state procurement rules. So again, and every state is different. So, it's been a significant investment to put a team together to really manage this process to help our customers, help the states that we serve, to get new, fresh, transformative ideas into the marketplace on how a virtual health system could help them achieve their goals. Also, there's another element, and I touched on it earlier about speed and about time, and because these states need wins. It's as we record this, it's the middle of March, and the federal fiscal year is coming up at the end of September. There's thresholds there, and then additional thresholds over the next year. And so, needing to find partners that can implement shovel-ready projects.
Absolutely.
That's a construction term, obviously, but it's germane to this discussion because we can implement quickly.
Absolutely. When you hit on the transformation, that's been a huge word that is, not that it's new, but it's definitely been utilized in a new perspective, I would say, in the last few years. And, how has Avel eCare really now, or how do we want to play a part in this transformation of the funding? How do we become a partner with some of these communities and sites?
Yeah. If you really want to be candid, we've been doing rural health transformation since our inception in 1993. That's how we got to be who we are. And as technology has advanced, as services have advanced, you think about starting out in specialty care and doing those virtual consults to school health, to EMS, to crisis care. The list just goes on and on and on.
Yeah.
So you want to define transformation? Do a case study on Avel, because that's what we've been doing for our entire existence.
Absolutely. Well,
and not only on a services perspective, but from a technology perspective. And so, it's a good time to be here.
Well, I appreciate you going down the list of all of the different services that are provided, because what does that mean? Some sites have one service line and some have multitude. What does that mean for someone to really have the full continuity of care with Avel? What does that really look like, and what does that mean?
Yeah, that's a great question. And it's really, that really validates that virtual health system concept that has become so prevalent in being able to support our customers. Having an entire platform of services available to them, and being, in many, many shapes and forms, technologically agnostic to whatever that customer has made a decision around for an electronic medical record. I think I was talking to one of our providers recently, and I think she said she had 27 different EMR passwords.
Wow.
Just because that's the many variations of EMRs that were out there. And so, that's a great question, and something to ponder about. We're just so different.
Yeah, absolutely. So now, kind of going back to with rural health transformation, when we're looking at everything that Avel provides and offers, how do we now implement some of that into, getting into the funding and working with the states to really help them meet their initiatives that they've put forward? Yeah,
that's a great question. That keeps me up at night, to be real honestly. Sleep is a premium anymore, but a lot of the RFPs are starting to come out because CMS approved the funding, and I mentioned it. A lot of this depends on state procurement laws, and so there's been a great deal of learning that has gone into those processes, but also there are just some states it's hard it's going to take a while for them to act on the premise of rural health transformation, because in a lot of cases they've got really arcane procurement laws. There are some really big states out there that it's going to take months and months for them to get some of these dollars to work.
Yeah.
That they've been appropriated, or not appropriated, but they've been granted by the federal government. And so I'm concerned about that. And there's some states where we have a big presence and support lots and lots of hospitals that may just not see some of the fruits of their labors as quickly as maybe they had hoped.
Yeah. One part of that too, looking at, telemedicine as a whole, as a part of some of these initiatives. I know we talked a little bit about, before COVID, no one really talked about telemedicine and the impact that it made. And then it blew up, but we've always been around and we've done this before. So what is that when we're talking to different healthcare leaders? How does telemedicine play a role into that now versus what it used to be? And how does that play a role into this funding?
Yeah. I'm going to reflect back on my military career. And what were those, tactical advantages that we had as an organization to help us accomplish the mission? I really look at telemedicine as that combat multiplier. It's a strategy, and a strategy with years and years of proven performance to help a community, a healthcare provider, or a government to meet their goals and do it on time, on budget, and really, be there to help them achieve their mission.
Yeah.
That's really how I think about
That's a cool way to
telemedicine.
think about that.
Yeah, it's just, that's kind of how I was raised. I did that for a long time. So how do we accomplish the mission? And I think for a lot of these folks, telemedicine is a key role to that.
So for those that are still a little iffy about this, which you don't see that as often anymore, but there's still some that don't love the full aspect of that. How do we get to them and say, how do you prove that telemedicine can be part of the solution as a whole? Yeah,
that's great. And one thing that really sets us apart from a virtual health system is our Joint Commission accreditation. Getting that seal of approval and recognition from a quality perspective that we're a very attractive option.
Yeah.
Super proud of our team and the folks that work really hard every day to make sure that we provide the best care, best service possible.
Yeah.
And that's significant. And talking to somebody recently who in the government space, and they had no previous knowledge of us. I had never met this person, but explaining to him who we are, he and again, it's a government official, and he looked me straight in the eye and said, "Sounds like we need to be more like you."
Yeah.
And so I invited him to come for a visit and kick the tires and meet the folks, just to be able to show him and show his team just what a virtual health system looks like.
That's amazing.
Yeah, it's a pretty fun combo.
Absolutely. Well, when you get to see it, it's a whole new ballgame.
Yeah.
Yeah. So let's talk a little bit more about workforce, as that's one of the bigger challenges. And I think, we talked about people are stretched completely thin. Recruitment is hard, as which we talked about earlier. And how do we now use telemedicine to help extend and support everybody rather than, the opposite? Yeah.
That's a super important conversation to have, because, the first thing that a lot of people think about is replacing.
Yeah, absolutely. Absolutely.
I'm going to do a telemedicine partnership, and that'll replace, and I won't need ABC or whatever, whoever. And that's 180% from the truth.
Yeah.
We are a support system. We provide, that's the whole premise that this organization was built on. But yeah, you're right. There's just not enough people to take care of the people, especially in rural America.
Yeah.
And if you look across the different services that we provide, it's even more exacerbated, especially, I'll just use behavioral health for an example. There's nowhere that I go around the country, even this week, earlier this week when I was, everybody wants to talk about, behavioral health services. We're super blessed to have a pretty robust team supporting some of the smallest and some of the largest, smallest community hospitals, the largest tertiary quaternary medical centers in the United States, supporting cities, counties, states, across the care continuum, and that team's absolutely amazing.
Yeah.
Recently, I was having a discussion with a policymaker about crisis care.
Yeah.
And it was in a higher populated state, and there was some concern about workforce, our workforce being able to have enough people to care for their people.
Okay, yeah.
And I gave the example. And we had recently an opening. We had a job posted for a couple of behavioral health nurses to support our crisis care service line. And over the period of a week, we had almost 500 applications for those two jobs.
Yeah.
I mean, that was pretty telling. Is there risk? Does that, there's also that takes somebody away from a potential bedside job, but it also kind of speaks to the attractiveness of, being a part of the Avel team and being able to take the knowledge, skills, and clinical capabilities of those individuals and spread it out to an even bigger population. So, yeah, workforce is a big topic of conversation.
Yeah. I kind of want to dive a little bit more, too, about the extension of becoming part of their team and what that means, because I feel like sometimes when we have had an encounter, we have a lot of off-putting people that are like, you're going to capture everything I'm doing and you're going to tell me what I'm doing wrong, or you're going to be my big brother and I don't want you to be my big brother. So what is that? When we say we're an extension of your team, what does that really mean?
Yeah, that's, a couple of things.
Yeah.
First of all, and as I explain it to a lot of folks in the government space or even in the hospital space, our providers become your providers. It's
Absolutely.
that simple.
Yep.
They become part of your team, licensed, credentialed, privileged in your facility, regardless of whether it's a federal, state, irrespective of that. And so that helps.
Yeah.
But also, we've got a phenomenal implementation process, but even better implementation team. And one of the key elements of that whole implementation process is change management. And, across our organization, helping those local partners to, because we've been doing it for so long across so many, we've got so much experiential knowledge out there to help those local champions that saw fit to have a partnership with us and to take those learnings and really help get those services implemented in that local community.
Absolutely. When we're looking at, all the things from rural health transformation, we just talked through many of the ways that Avel can be a part of that solution. As now a government leader, a policy leader, a healthcare leader, what am I thinking about right now for my next steps? Like, what's going through my head about what do I need to do right now?
Yeah, that's a great question, and I have those conversations multiple times a week. I recently got just a text, a random text, and hey, do you have a second to talk? And I said, of course. And so I gave him a call, and he wanted to know more about rural health transformation in his state.
Okay.
And the topic had come up around behavioral health in particular, and one of the services that we provide in a number of states around the country. And supposedly there was a conversation about lack of access to care, local, not enough people to care for the people.
Yeah.
And so, those types of questions are happening. But,
Yeah.
The other side, from a rural health transformation, a lot of these policymakers are fatigued.
Okay.
And they're fatigued because there's been such a short window
Okay. Yeah.
from when the legislation was signed in July, the notice of funding opportunity came in September, the applications had to be in November, and then they got their initial response back at the end of the year. But also at the same time, everybody's calling. Everybody wants to set up meetings to talk about A, B, C, or D. And, and so there's a lot of public folks that have just kind of, they won't respond to their emails. I've heard this locally and nationally that because it is a public procurement process,
Okay.
to follow the process, they need to stay to follow those guidelines. And so, there's a little bit of fatigue because it's such a big topic.
Yeah.
And there's so broad pockets that organizations and communities can act upon. And, there's a state yesterday that they had a large RFP package come out, but it was rural hospitals, federally qualified health centers, not-for-profits, and one other group of organizations that's all that they were going to fund with that one. So, they're just setting the rules and expectations.
Yeah, absolutely. Well, and I can see why it'd be fatigued because it probably feels lonely too. Like you don't really know how to do this. So when we are looking at this, what does the partnership level look like? Or how do we make sure that people can work together to truly get what's out of this funding?
Yeah. Sustainability is key. And having a good partner is wildly important.
Yeah.
And, we've got some great, not only hospital partners that we work with every day, but we also have some great cohorts that we built. Like Cibolo Health, phenomenal little organization that is, really working about changing payment methodologies. How rural healthcare organizations can grow and thrive and survive in these times. And fortunate to be their telemedicine partner. And, they've got a big footprint and growing every single day. And so, that's just one example of collaboration and building cohorts to not only build on that relationship, but also for their members.
Yeah.
And so that's an important piece of this too. Is not only that direct stuff that we work with every day with governmental entities, but it's those collaborations that's going to be key because again, it's all about sustainability.
Yeah.
And being able to, once the federal funding shuts off in 5 years, continue to grow and thrive from there.
Yeah. So let's look ahead now that we're talking about sustainability in the future, and we have to keep that in order to keep moving forward. What does that look like if everyone is successful with rural health transformation in the next 3 to 5 years? What does that look like?
it'll be a celebration, first of all.
Yeah.
Yeah, that'll, but again, it depends. It's, I was reading recently about like the state of Wyoming. They are looking at a strategy to essentially take the funding and endow it.
Okay.
So it resides investing those funds, investing the funds into a one of their government vehicles, but then using the proceeds to fund activities in their state, not only over the next 5 years, but also potentially
further down
forever.
The road. Yeah. Okay.
If they make their investments right. That's a really interesting strategy. I know it's being strongly looked at. I haven't checked this week on the status of that, but that's a very thoughtful way to consider the long game.
Yeah.
And how that plays out. But also, it involves different like the work that our partner Cibolo does about payment methodologies and value-based care methodologies for sustainability after the fact. And so, I think going back to, way at the beginning of this, we talked about infrastructure.
Yeah.
And, virtual infrastructure is just important as brick and mortar. And in reality, there's not a lot of brick and mortar in the rural health transformation. You can make upgrades, but you can't build new stuff, really.
Exactly.
And so, that virtual brick and mortar, if you will, is a key part of that.
Absolutely. So when you've talked to all of these different policymakers and you yourself in this realm, what has made you optimistic about this opportunity that we have right now?
A lot of things. Going back and looking at all those state responses that we as an organization responded to, now starting to see some requests for proposal, requests for more information come out. That's I'm really warmed by the fact that we have a system of care, a platform, across the care continuum, from all the way from an ambulance, pre-hospital, all the way out to post-acute in the senior care space. There's a lot of ways in that whole continuum that we have the ability to impact care.
Absolutely.
And that's really warming, especially, all the results that we've been able to achieve over the last few years and being able to educate policymakers about, whether it's, senior care, whether it's school nursing, because a lot of states have some element of school-based care in their plans. Because interesting statistic, and this came to light when we were doing an RFI recently for a state, 67% of the kids in K-12 in this country don't have a primary care provider.
67%.
67%. And so that was really a light on because if the importance of our...
So their school nurse is their primary care.
Bingo.
Yeah.
That's huge.
Yes.
And if we want to truly improve access to care in rural America, in K-12, virtual could be a way to have that strong impact.
Absolutely.
Same way along with behavioral health. Being able to provide those kiddos access to scheduled therapy appointments via telemedicine, but in the safety and safe surroundings of their school where they're comfortable.
That's awesome. Very cool. Well, you've given us a lot to think about today. It's been really fun speaking with you, but before we wrap up, we like to do really quick questions of just give me your shortest answer to the question, okay? So what's
Wait a minute, short?
Short. We got to keep it
How
nice
long have
and
we
short
known
and
each
sweet.
other?
Too long. No. So very quick, what's off the top of your head? So what's one misconception people have about rural healthcare or telemedicine that you wish more people understood?
We're a partner. We are a partner in care. We accentuate, and we're that combat multiplier.
Yeah.
We're that tactical advantage to help win this battle to improve healthcare in rural America. That's who
beautiful.
we are.
Love that.
Yeah.
So if you could change one thing about how rural healthcare kind of operates today, what would that be?
Oh boy. Was that in your pre-notes, or is this something you just came up with?
You'll never know.
If there's one thing that I can change, I think the one thing, if I was in the legislature again, or if I was doing one of those old roles in my old life, I would want to change payment methodology for EMS. You know, EMS in this country is woefully underfunded. It costs, you know, and I've seen some statistics 3 to 4 times what it actually gets in reimbursement.
Yeah.
And EMS is such a strong part of the healthcare continuum. If I had one subject area that I needed to focus on, I would probably do something around EMS.
That's interesting.
Yeah. That's
Never
just
dived
me.
into that. Yeah. We'll have to talk about that another time.
Well, and it's important because, you know, as we, you know, support so many, you know, communities around the Upper Plains with telemedicine and talk more about sustainability.
Yeah.
That's an important piece of it.
Absolutely. Well, it's been a pleasure to speak with you today about all things rural healthcare, all things that are kind of in the government space right now to impact that. If there's one takeaway that policy leaders, healthcare leaders are listening to today, what would you want to give that as a takeaway?
Yeah, I'm going to go back to telemedicine is a strategic advantage. You know, having a virtual health partner with the full continuum of services across the healthcare ecosystem, across the lifespan.
Yeah.
That is transforming rural healthcare.
Yeah.
And you make fun of me. I know you do when I talk about rural vitality, because I talk about it regularly.
Yeah.
But that's a key part of this whole our whole being is rural vitality. You know, giving citizens in rural America, you know, better access to care, better outcomes, better value to the taxpayer at Triple Aim. And so, you know, having a virtual health system partner like Avel with that breadth and depth of services that we have, that is a strategic advantage.
Mark, well, it's been a pleasure. Thank you for joining us today. All of your perspectives and your background just really brings light to everything that's going on, and appreciate you sharing all of that knowledge with us.
Well, great to be here. Yeah. Great to be a part of the initial version of the our new podcast, and so happy to help you whenever I can, and I'm really looking forward to learning from other leaders and stakeholders through the organization as we grow this new brand.
Absolutely. Thank you so much, Mark.
Yeah, appreciate you.
Yeah. And thank you for joining us on Avel eCare Virtual Health Connections. If you found the conversation helpful, we'd love for you to subscribe, share it with your colleagues, and stay connected with us as we continue exploring telemedicine and the future of healthcare delivery. To learn more about Avel eCare and how we're supporting care teams across the country, visit avelecare.com. Thanks again for listening. Until next time, stay connected.